Hello everyone, I am Lekhana, Assistant Professor, Department of Medical Laboratory Technology, Yenepoya School of Allied Health Science. Today I am going to take a session on glucose tolerance test. So by the end of the session, learner will be able to define glucose tolerance test and list the indication and contraindications for conducting glucose tolerance test and identify the types and its specific uses and explain the patient preparation procedure used for the conducting oral glucose tolerance test, interpretation of GTT response curve. So let's start with the definition. The glucose tolerance test is nothing but it's a measure of ability of a body to utilize glucose. Here we are giving a glucose of a known amount either orally or intravenously. So after giving the oral or the intravenous glucose, we are estimating the blood glucose level. Next we will see what are the indications. Patient having a symptoms and if there is a fasting blood glucose level as well as postprandial blood glucose level is of not conclusion, then only the doctors will prescribe for the oral glucose tolerance test. And during the pregnancy, if the pregnant woman is gaining a sudden weight or there is a previous history of big baby or the past history of miscarriage or the gestational diabetes, then doctor prescribe for the glucose tolerance test. Other than that, we can use glucose tolerance test for ruling out the benign renal glucoseuria. Next we will see what are the contraindications. So when the patient is already confirmed with the diabetes mellitus, we cannot do the glucose tolerance test, and if it's not a follow-up test, it's just a initial diagnosis which can be used for the diabetes. This test should not be performed in a patient who is acutely ill. Next we will see the types of glucose tolerance test. Oral glucose tolerance test, mini glucose tolerance test and extended glucose tolerance test and intravenous glucose tolerance test. These are the 4 types of glucose tolerance test we are doing. So now we will see what are the patient preparation has to be done for the glucose tolerance test. Here the patient should have normal carbohydrate diet 3 days prior to the test, and if possible the medications should be stopped 3 days prior to the test which are affecting the glucose utilization. Strenuous exercise should be avoided prior to the test, and patient should be in the fasting for 10 to 12 hours. Patient should not smoke or drink alcohol prior to the test. Next we will see the procedure. Here when the patient comes with the fasting for 10 to 12 hours, fasting blood and urine sample is collected. After the collection of blood and urine sample, the glucose load is given. In case of adults, we are giving 75 grams of glucose in the 250 ml to 300 ml of water. In case of children, we are giving glucose load of 1.75 gram into body weight of the baby. It should not exceed 75 grams. Patient should be seated comfortably and we should ask a patient to drink the solution within 5 minutes. Patient should not vomit. If the patient vomits, the test should be discontinued and it should be performed next day. Next we will see sample collection. Here urine as well as blood sample is collected every half an hour for 2 hours after the post glucose load. Analysis. The blood glucose concentration is measured by glucose oxidase peroxidase method or exokinase method. In case of urine sample, it is tested by Benedict test. After the measurement of blood glucose level in the plasma, the graph is plotted. On the x-axis we are taking timeline and on the y-axis we are taking the concentration of plasma glucose. This is a curve. We call this curve as a glucose tolerance curve. So we will see the interpretation. If the person is normal, fasting blood glucose level should be of 70 to 110 milligram per deciliter. On the first hour of glucose load, it should be less than 160 milligram per deciliter, and of 2 hours less than 140 milligram per deciliter. Next, we will see what are the criteria for impaired glucose tolerance. Here, fasting blood glucose level should be in between 110 to 126 milligram per deciliter, and in case of 1 hour it is not prescribed, and in the second hour it should be 140 to 199 milligram per deciliter. Criteria for diabetes mellitus: the fasting blood glucose level should be more than 126 milligram per deciliter, and for the first hour it is not prescribed, and for the 2 hours it should be more than 200 milligram per deciliter. Next, we will see what are the side effects of doing this glucose tolerance test. Here we are giving highly concentrated sugar solution to the patient. It might lead to a stomach discomfort, nausea, diarrhea, constipation, especially the patient who is having a high blood glucose level. Other than that, it can also lead to the reddishness and swelling at the site of puncture, and it can also lead to the infection as well as fever. Now we will see the condition where decreased glucose tolerance and increased glucose tolerance is seen. So decreased glucose tolerance is seen in case of diabetes mellitus, gestational diabetes, insulin resistance, hyperthyroidism, hyperpituitarism, hypoadrenalism. Increased glucose tolerance is seen in hypopituitarism, hyperinsulinemia, hypothyroidism, and liver diseases. Next type, mini glucose tolerance test or the modern GTT. As per the WHO recommendation, here we are collecting 2 samples. One is fasting and one is after 2 hours of glucose load. Here both blood and urine samples are collected. Next, we will see extended glucose tolerance test. Here the samples are collected for every half an hour for 4 hours. So we are following same procedure here. But we are extending the timeline for 4 hours. Uses: here we can differentiate insulin secreting tumor as well as if there is any other endocrinal disorders that is leading for hypoglycemia. Next is intravenous glucose tolerance test. This test is only prescribed for the patient who is having a malabsorptive disease. Here IV GTT is accurate for assessment of first phase of insulin release. Abnormal IV GTT result occurs prior to the diabetes onset. IV GTT is rarely performed. Let's see the procedure of intravenous glucose tolerance test. Here 25 grams of glucose is dissolved in 100 ml of water and it is given as a IV injection. After completion of IV infusion, the timeline is taken as 0 and every 10 minutes for 1 hour blood sample is collected. Next, we will see the interpretation. If the person is normal, blood glucose level should return to normal within 60 minutes. If the patient is diabetic, there will be slow decline of blood glucose level. Next, we will see the summary. Glucose tolerance test measures the ability of body to utilize glucose after administration of known amount of glucose. Indications: it is done in the suspected diabetic patients and pregnant woman who is at the risk of getting gestational diabetes and renal glucosuria. Contraindications: it should not be done in the confirmed diabetic patient and patient who is acutely ill. Types: oral glucose tolerance test, mini GTT, extended GTT and IV GTT. Patient preparation: normal carbohydrate diet 3 days prior to the test, no smoking, alcohol, exercise and 10 to 12 hours of fasting is required. In case of adults, 75 gram of glucose is given orally, and in case of children, 1.75 into body weight. It should not exceed more than 75 grams. And urine and blood samples are collected every half an hour for 2 hours. Interpretation: 2 hours value less than 140 milligram per deciliter is normal. 2 hours value 140 to 199 milligram per deciliter is impaired glucose tolerance, and more than 200 milligram per deciliter indicates diabetes. These are my reference. Thank you.